All right, well, welcome everyone. I am really grateful that you're all here because it's so important the work that we do with the media and journalism. And so just to introduce myself, I'm Patty McCarthy. I'm the Executive Director of Faces and Voices of Recovery. We're based in Washington, D.C., and we're a national advocacy organization. And we work on putting a face and a voice on recovery, having people come out of the shadows, talk about their recovery for a purpose so that they can influence public policy, change public perceptions, eliminate the stigma of addiction. And so a lot of the times we are working with or training individuals around the country to share their stories in a way that actually creates a positive message of recovery from addiction. So it'd be great if we could just go around and say who's here. So and who you work for.
Yeah, I'm Kelsey. I work with Thompson and Company, and we do public relations with Recover Alaska.
Great, thank you.
I'm Rosie, and I'm Executive Director of Alaska Press Club and Director of Alaska Teen Media Institute.
Oh, great.
I'm Jennifer Summers from KTVA.
Excellent, thank you.
Aubrey Weaver from the Anchorage Daily News.
Thank
Paul
you.
McGovern of Anchorage Daily News.
Nice. Well, this is great. We have the right people in the room. So you may have already, you've been dealing with and writing about addiction for many years, I'm sure. And now with the opioid crisis and the epidemic, there's a lot more attention paid to it, which we've been trying to get the attention of folks for many years around alcohol use disorder and other drugs. But this is a great opportunity to learn a little bit more about like the brain disease, the science of addiction, and how we use that information to help people understand that it's not a moral issue. It's not a moral failing, that a lot of what we're dealing with is, especially with opioids, is a chronic medical condition that needs treatment. And with appropriate treatment, people can and do recover. So we're lots of people. There's 23 million Americans in recovery from addiction, which is about 10% of the population. There's also 10% of the population that can be diagnosed with a substance use disorder. So oftentimes in the media we see people or the issue addressed in a way that uses language that is not helpful to addressing the stigma. So we've seen many situations where individuals are shamed or called out for it, or things that have happened where we want to, educate. And so I'm going to start with just talking about a better understanding of science, the science of addiction and recovery, how stigma affects people individually, but also the community. Communities can be affected as a whole where substance use is prevalent. And then mostly we're going to talk about the words that we use that can support people in recovery and help to destigmatize the issue of substance use disorders. So you have a few handouts. I just wanted to tell you what's here, and you can look at it. These are resources to take with you, but mostly just understanding that the AP, the Associated Press style book changes were made in 2017 to help journalists understand that we want to avoid words like abuse, problem, addict, and abuser in most cases. So we're going to talk through why that is and the reasoning behind it, and why the recovery community and advocates like myself have been out there working on this issue. And we partner with media and journalists so often to tell the story in a way that's helpful and can really celebrate recovery and show that the promise of recovery. Now we know that there's things to report on that are urgent crisis, the things that the criminal justice aspects of addiction, or the overdose rate, which is just alarming. But being able to use words that describe the person helps it put it into a healthcare context versus a personal failing. So there's that document, which is around the AP style guide. And then some other resources that are easy to use, a resource guide from SAMHSA, the Substance Abuse and Mental Health Services Administration, put together this resource guide on overcoming stigma and ending discrimination. And then a couple posters that are easy to, use, and it helps people in recovery who are telling their stories really understand the positive words and then the negative words, especially when advocating and in journalism. So many times our advocates are trained to go to state houses to respond to calls for their story or their response to an issue in a community. And so we try our best to give these talking points, and we actually created a training called Our Stories Have Power. And part of it is it gives people an opportunity to practice if they're interviewed with a reporter on how to use that and how to redirect if that reporter is asking them questions about, their prior drug use or things like that, where we want to shift. We teach people how to pivot back to the promise of recovery and the positive stories. So ASAM, the American Society of Addiction Medicine, in 2019, so this is just last year, updated their definition of addiction. And it's really important to put this in the context of the treatable chronic medical disease, and that it involves complex interactions including brain circuits, the neuroscience of addiction, genetics, so family history, the environment where people are raised, and that includes cultural trauma or experiences in their own community, trends and prevalence in a community or in a state, and then an individual's life experiences. So when people with addiction use substances or engage in behaviors that are compulsive, it oftentimes continues despite the fact that we know that harmful consequences occur. So that could be either health issues or criminal behavior, or those type of things continue to happen, but that it's because of, we know now it's a brain disease, that we have to make sure that we put appropriate treatment and long-term recovery supports into place. So we know that prevention efforts and treatment approaches for addiction are also as successful as those with other chronic diseases like diabetes. If we help people understand, change their eating habits or taking their medication, they're very successful in other chronic diseases. And I think that with addiction, we need to help people with treatment and recovery support services, which are different than treatment. They're the things that happen in the community or in their own family that can change the way they recover. So for successful recovery. Welcome, come on in. So virtually all substances create this effect for dopamine levels in the brain. And that's really the core of why we talk about the science, because people that become addicted to substances, oftentimes what happens is that the brain chemistry changes and they're seeking that reward, which comes from the dopamine in the brain. And so when the substances are taking over, then that person no longer finds reward or pleasure in other activities. And so that's a constant craving for it. So that's what happens in the brain. Hi, Jess. Welcome. So this is stronger than natural rewards. The natural rewards like exercise or a comedy show or the things that people do to get pleasure in their as they grow up, and they learn those things once the drugs are introduced for a period of time. It releases 2 to 10 times the amount of dopamine, and that some drugs are that are smoked or injected get almost increase that dopamine immediately. So it results in a decrease of the natural rewards on effects such as eating and sex. So that's why we want to make sure folks understand the science behind addiction, and that there's a lot more research nowadays that substance use disorders are characterized as a chronic medical condition and a brain disease. Once we see that long-term use, the impairment on the brain, the brain adjusts to those surges of dopamine by producing less dopamine and reducing the number of receptors where dopamine can latch onto. So it's the brain reward circuit becomes abnormally low. And this oftentimes manifests itself. You'll see people who have a flat affect, lifeless, depressed, because during that time their brain is still craving that substance to bring it back to normal, to bring their affect back to normal. And oftentimes they're vulnerable or more vulnerable depending on the choice of the drug. So if they are using a opioid versus a marijuana, their addiction level or the brain changes that occur are different, and how they administer it. So if it comes in through smoking or injecting, they become more likely to become addicted. If they use it more often or for longer periods of time, and also motivations for use. So coping with past trauma as a coping mechanism is higher vulnerability than others who may have learned problematic use of substances as a developmentally, like in college. That's very different than those that have been using it for a long period of time to overcome their past traumas. The good news is that recovery is possible. So there are 23 million Americans in recovery from alcohol and drug addiction. And we know this because we did a survey in 2012 of, it was done by the New York Office of Alcohol and Substance Abuse Services and the Partnership for Drug-Free Kids. And the question that was on the survey was, did you once have a problem with alcohol or drug use and no longer do? And the response was 10% of the people said yes. The important thing to remember is there are many pathways to recovery. So not everyone recovers by going to treatment. They may or they may not. They may find recovery in their community by going to mutual health groups like 12-step meetings. Or they may find that they went to their doctor and they found out that their liver is failing, and if they don't stop drinking, they will, further consequences. So they stop using alcohol or drugs. So there's a lot of different reasons and multiple pathways of recovery. Yes, sure.
So I don't want to derail the conversation, but I do want it to be a conversation. And I haven't seen a ton of really great examples of news or media in general covering stories of recovery. Like usually when it's about recovery, it's like, all right, tell us about your addiction, and then like, cool, you're not, in active addiction anymore.
Right.
But it's not really about recovery. So do you have any examples?
Absolutely. I have seen communities, because I do the Google alerts, like the media alerts, and anytime so that I have seen communities that they've continued to do positive stories of recovery, like as a series. Mm-hmm. And, I think that, so everywhere from NPR to, local news channels or newspapers that will continue to, but the important thing is to help the people that are doing the story to understand the language. But we have seen series done. I can, go anytime on my daily Google alerts and it'll say recovery story this week, so they'll find somebody in the local community to tell their story. And it's nice to get a diverse group. This month on our social media, we're doing Black History Month, so we have a number of people in recovery. Every single day we're putting a new post of somebody in recovery from the African American community, and we like to highlight the various pathways and the cultures. So here, I think, and I met with a reporter in Kenai who does stories of Alaska stories, and I met with them also. They were there, but I can't remember this. I have his card, but he interviewed me afterwards, and he's trying to figure out how to use it, but it is about Alaska communities and stories of recovery. So I think there's a lot of ways we could do that.
Yeah, I think I meant like more outside of a series, because like Recover Alaska, and I think Indiana.
Yeah.
People do series, but like something more consistent about like recovery is part of our community,
Yeah.
and we don't have to focus on addiction in our community. We can focus on recovery and shift that social norm.
Yeah. Well, what we've seen, because we have a network of 150 organizations around the country that are part of our organization, they're member organizations, but what they do is they invite, when they have events or activities going on, or say there's somebody that they want to highlight that is, struggled for years, but now they're volunteering in their center and they're giving back. They went through the peer support training or the recovery coach training, and there's something really cool they want to celebrate. They invite the press in to talk about that. And we need to do that more to show that, this person, has come a long way. And they used to make the news because of other reasons, but now they're in recovery. So I think that that's part of both the community's job to call and try to get that attention to talk about it, as well as the media to at least equally show the promise of recovery, as well as, we oftentimes look at the harmful effects, but also, on issues. So there's policy issues. So if you have a case where people are continually being denied insurance or denied access to treatment because of their insurance, maybe showing a positive story about how somebody did get into treatment because their insurance paid for it and covered it appropriately. And so here's that person or that family now. So, and that's what we call positive peer pressure, because it also puts pressure on the other insurers or the other businesses or the other treatment centers to make it more available. So this definition came from a large group of people meeting with the Substance Abuse and Mental Health Services Administration, which is our federal agency that provides funding to the states. And in all of the communities that I've been in Alaska, we've talked about this definition. I've asked what jumps out at you. And the process of change, meaning that it doesn't happen just one day and it's a period of time that it happens, was really important. The other thing that they liked is self-directed, meaning that people have a choice in how they pursue their recovery, what pathway they choose, and that, if they're but it gives more empowerment and self-esteem if it's self-directed. And that they pointed out that this definition does not include abstinence. So it does not include the fact that, many people think that when you stop using alcohol or drugs, that's recovery. But that's not necessarily true, at least from the general consensus of people in recovery. They feel like it's, improved health and wellness.
So in other words, you don't have to be abstinent in order to have it covered. Or to be in recovery, you can still drink.
There are pathways like that, moderation management, where people have to they do go through a process of looking at the harmful patterns of drinking. Mm-hmm. It really is individualized. I can't tell someone that it's okay that you're still drinking or using drugs if it's having harmful effect on your life, that's recovery. But it is really individualized.
I think some people, when they hear the word recovery, they do think of abstinence. Like,
Yeah.
you can never go back to using any kind of substance. But it sounds like you're saying that some people moderate.
Exactly. Exactly. But they have recognized that they had a problem and they got appropriate help for it.
Okay. Also, are you going to make these slides available?
Yeah.
Okay.
Yeah.
I think that's interesting though, from like a public health messaging standpoint, because traditionally, in my experience anyway, the message is, what is moderation is subject to interpretation. So what I think moderate drinking is might be different than what Paula thinks moderate drinking is. And so how do you get that message out accurately so that it's understood by all audience members or readers or viewers?
Yeah. And my message usually is it's a conversation with your doctor. So your doctor should be aware, and they're doing screenings like how much alcohol do you consume, and this is the healthy amount for a healthy woman of your age, and so having that conversation with someone. I don't know that in my experience, because I'm a woman in long-term recovery and I haven't used alcohol or drugs in over 30 years, generally, when we talk about recovery, it does include not using alcohol or drugs. But there are certainly people that have, we approach it with a harm reduction approach. So if you're oftentimes in early recovery, you're working with a counselor, and they will, especially with young people, they're like, this is excessive use according to our guidelines, and we need to help you look at that and what you can manage. And in my own experience, I was drinking alcohol every day in high school, so before school and then after school or on weekends. And so my counselor said, well, let's start somewhere. Let's cut out drinking before school, So there had to be a point where you could start to figure out what you can manage and what you can't. And there are quick assessments tools like the CAGE, which I think is like a 4-question tool that asks, have you ever tried to cut down on your drinking? And I'm not an expert on the treatment end of things, but
Can I
Yeah.
say something
Yeah.
about that? So, like, most of us have heard the phrase drink responsibly. And that phrase comes to us from alcohol industry. So alcohol industry is basically telling us how to consume their product. The CDC does have low-risk drinking guidelines. So low-risk drinking guidelines are no more than 3 or 4 drinks per occasion for women. I think it's no more than 3 drinks per occasion for women, no more than 4 drinks per occasion for men. So any more than that would be considered binge drinking. No more than 7 drinks per week for women, no more than 14 drinks per week for men. Any more than that would be considered heavy drinking. So we do actually know what moderation could look like for the average man or woman, and it's different by gender because of the way that bodies metabolize alcohol. So those do exist. There are lots of screening tools. Recover Alaska has one on our website to assess someone's drinking. And then moderation management is one of these programs where it takes you from problem like, I was a binge drinker. I'm sober now, but if I still drank, I would drink, moderately or in a low risk way. And so that low risk definition also includes no drinking. So for some people, drinking is harmful, so they 0 drinks per occasion because they're low risk.
Right. Okay.
Yeah.
Yeah, no, it's just interesting,
It's really a very clunky public health message.
Yes, yeah, that's kind of what I
And
was
it
getting
seems to
at.
change a lot, like now it's 1 drink a day for a woman. Anything over 1 drink a day or 7 a week is considered heavy. Whereas it seems like a few years ago it was 2 drinks.
Well, and it's interesting because there was this landmark article that was published in the Lancet, I think a couple years ago. It's basically saying alcohol is poison, nobody should be drinking it.
Yeah, I've seen
But
that.
the U.S. government really isn't on board with that, but UK is, and I'm pretty sure that they have public health messaging that says no amount of alcohol is low risk. So, I mean, we know that drinking any amount of alcohol increases a woman's chance of contracting breast cancer. I mean, there's all these other health risks outside of addiction, and so, I mean, that's some of the messaging of Recover Alaska that it's coming down the pike. We're not quite there yet, but it's really interesting and fascinating to think about where we're at in the public health sphere because it feels so intractable because it's been part of our country since its inception.
Yeah, we could go forever on that one. I think the important thing for the recovery community or for the public to feel supported is to know that the majority of the people with a history of problematic use are not using anymore. So that's when we consider all of the resources that need to be in place to make communities ready for people who are in recovery because there's so much alcohol and drug use that's prevalent, or especially alcohol use in the public. So creating more substance-free recreation is important. So this is just an example of a brain scan. So the first one is a normal person, and then with the low amounts of the red is the dopamine, and then as you go to 1 month after detox, the person has starting to get back a little bit, that's actually very little dopamine in the middle. And then 14 months after, they start to get that back. So I think this is important for people to know, because if we talk about it as a brain disease, we need to show that brains do heal and they can get better. Because
is it that the receptors have come back?
Yeah.
Or like what produces the dopamine coming back? Is it neural pathways?
Yeah,
in the
they're
brain that are
being
in-
reconnected. They're learning new things. So previously in their active drug use, it would tell, they wouldn't learn positive reward because it was taken away. So as soon as they start to experience that without alcohol and drugs, they come back. And I'm not a scientist, so I can't really explain all the details, but I do know that this information, at least just these little tidbits, shows families that person that they thought had no hope, they weren't their memory was gone, their behavior was erratic, they had no judgment, that because these things are coming back, that we know that they can get better.
And does that apply to alcohol too, or just?
Yeah, there is the same studies for alcohol. It's true. All of the substances, it's really related to the dopamine receptors and not the substance itself. So, reward circuitry. So the brain has a remarkable ability to adapt, heal, and change. And the key is the length of time and experience after the drug leaves the body. So the longer the period of time without it, the more likely that it's going to heal. So really what the most big thing we wanted to talk about is the stigma and language. So this is Michael Botticelli. He's the former director of the White House Office of National Drug Control Policy. He's also the first person in that level of government to be openly in recovery. And a couple of years ago, or a few years ago, this is the prior administration, but he talked about ONDCP put out a guidance document and a statement. I think it's referred to in your resources here on the resource document, in which you could see. So the federal government said, we need to stop stigmatizing people by changing the language, and we can break that stigma and talk about it as a disease. So, and stigma, there's many different definitions, but this is really important because it's an attitude against a group of people that can destroy a person's dignity, marginalize this group of individuals, violates basic human rights, and reduces the chances of them reaching full potentials, seriously hampers the pursuit of happiness and contentment. So I really like this definition because it also helps us look at all of the discriminatory practices that happen. Things like, and I have another slide in a minute, but the stigma comes from the issue with it coming from within is that people see themselves as less than and not worthy of things that the general public, the rest of the community, everybody deserves as, basic human rights. They feel hopeless. And then the stigma from the recovery community, now that we've had a lot of talk about medications for opioid use disorder, there's the issue of, are you really in recovery if you're taking medication? So there's stigma within that, which we know medication is the best treatment for an opioid use disorder. So there's some of that comes from within people in the recovery community. And then from the outside, again, this contributes it, that it's a choice, that if you just stop and pull yourself up by the bootstraps versus being a disease. And there certainly is a certain amount of things that a person needs to be willing to do to get help or to be successful in the treatment. But we need to understand that it needs to be treated just like any other health condition. So the stigma comes from the public or institutional stigma, like policies and practices, and then self-stigma. It certainly contributes to things like depression. They're less likely to seek help. That's the number one issue I think that we hear when we survey why people are not accessing treatment when we know that so many people need it, is that they feel like they're going to lose their job because if somebody finds out that they have a problem with alcohol or drugs. They're less likely to advocate for themselves.
Can I also say something about that
Yeah.
for Alaska? So the Office of Substance Misuse and Addiction Prevention has been working on a resource guide for employers on policies and practices for individuals in the workplace that are in active addiction and how to have those hard conversations and encourage that folks get help, but also how to like hold their job for them if they need to go access treatment for a while, things like that. So that's coming. I think we're presenting on it in early April, so hopefully it'll be available soon.
That's great.
Yeah.
Yeah, that's really important. I mean, the employment piece, there's so many people that we know that this is it's all classes and it's actually they said like, you know, the rate of people with substance use disorder, it's very high amount of people are actually employed. So it's not like what we had think of or what most people think of, that these are unemployed people or involved with criminal activities. This is, especially with the opioid epidemic, we know that people have been affected by it at all classes, all races across the spectrum. So they're, especially after injuries or after surgeries, it's a highly addictive substance. So being able to come out and ask for help or professional help is, we need to make that more available within and change the culture within employers. So there's also this courtesy stigma, which means that family members are often associated with that person and looked at as if they had something to do with it, or if that family didn't, wasn't, they all are using alcohol or drugs, or it's something that a parent did. And so oftentimes they feel that affective stigma, and that has an impact on their work and their health. So that can cause depression for a family member, as well as lost productivity at work. Family relationships are strained. So how do we change that? We change the words that we use. And this is William White. He's an author and recovery advocate. He's an amazing researcher and historian in the recovery community who wrote the book Slaying the Dragon, The History of Addiction Treatment in America. And he also wrote Let's Go Make Some History, which is kind of where we as a recovery movement use those strategies to make a movement of people in recovery. And the words have immense power to wound or heal. The right words catalyze personal transformation and offer invitations to citizenship and community service. The wrong words stigmatize and disempower. So I really like that he's talking about citizenship and community service, because we all have that need and that, to be part of a community. And the opposite of addiction is connection. That comes from Gabor Mate. And he says the opposite of addiction is connection. So that's connection in our community. Having a place and not feeling like disenfranchised or disconnected to our community.
Can I ask you a question?
Yes.
So in Anchorage, there's a term that is used quite often by city officials and others, and that's chronic public inebriate. It's used to describe homeless people that are often panhandling or living in camps. What do you think of that phrase, chronic public inebriate?
Oh my gosh, they're humans first, they're people first. I'm not sure how we want to label them, but how about people with chronic alcohol use disorder? So shifting the language, we're going to talk about that in a minute, but shifting it from, I think it's labeling, it's stigmatizing to use it that way, but it's chronic is true. Chronic is part of the characteristic of alcohol use disorder once they're diagnosed with that. So I'm not sure. I would talk about it, I would always put it back to them to say, can you rephrase that in a way that used person first? So people experiencing homelessness, people with a substance use disorder, people with experiencing chronic homelessness. I think that that makes more sense.
Mhm.
And inebriate is an outdated word. You know, it's on the books, it's the laws, but I think we can do better, use better language than that. Let's see if any of these language suggestions that I'm going to talk about make sense there. But Don Koyas is the founder of the White Bison, the Wellbriety movement. So he comes from, he works with a lot of tribal communities. He's based in Colorado Springs, but I love this because he talks about, you know, if you want to care for something, you call it a flower. If you want to kill something, you call it a weed. And he also talks about a healing forest. So if you have a forest full of trees and one tree is not doing well, it's getting sick, it's a sick tree and it needs help. Oftentimes you take that tree and you wrap some support around it, you bring it to a place where you could, you know, a new greenhouse where you can nurture it and give it all the food and water that it needs to get well. But then you bring it back to its own community of trees and then back into the forest with a lot of other unhealthy trees. So the idea that he talks about is treating the soil, that we need to treat the soil to heal the forest. So I think that some of the words from his wisdom have been really helpful to us to talk about why words matter, and how we treat the community level and the policies and the culture of your community versus, you know, we have to do it all at the same time, you know, so this study about the word, so one word that we're trying to take out of our vocabulary and we need the help of media is a substance abuser. So we're just looking at the word abuse here. So this study was recently done by the Recovery Research Institute, leading researchers at Harvard. And the participants were asked how they felt about two people actively using drugs and alcohol. So one person was referred to as a substance abuser and the other person was referred to as having a substance use disorder. And no other information was given about these people, but the study discovered that the participant felt that the substance abuser, so with the word abuse in it, was less likely to benefit from treatment and more likely to benefit from punishment. And they think, when you think of the word abuse, what do you think of? Violence. Yeah. You think of child abuse, domestic abuse. So it was really important to make it into a medical term, so substance use disorder. So we asked people to take the word abuse out of your vocabulary. It doesn't make sense. A person, and it also implies that people who, if you use the word substance abuser, are violent.
But what about like a teenager who's experimenting with like the drugs in their parents' medicine cabinet? You know, like they're trying these pills, these pain relieving pills. They haven't gotten to the point where it's a chronic disease, but certainly they're abusing it at that period of time.
They're misusing it.
Mm-hmm.
They're not abusing it. They're misusing it.
What do you feel is the difference between misuse and abuse?
Well, I think abuse is you know what the public thinks is that it has to do with physical harm. I mean, physical violence or physical hurting, and I know that misuse means that prescription drugs are prescribed to be used a certain way, and when they're taken from other people, like not appropriately, that's misusing them. So we're not using them the way that they were prescribed. So it's misuse.
Is there, I mean, how much research has been done on that? I know you brought up this study, but I have no idea how many people are involved in this.
Yep.
Whatever.
There are a lot of studies on that one.
You know, I personally, I've
Yeah.
never connected. If I hear someone is an alcohol abuser, I don't think, oh, and they also physically abuse their children.
Yeah.
Like that, to me, is a bit of a leap. And this, I mean, this isn't just something with alcohol or substances. This is a thing, you know, society puts a stigma on a term that maybe originally didn't hold that stigma, and so then we change it, and then that ends up getting. I mean, is it just kind of an idea of replacing it, or it's such a similar phrasing, I guess. Like in looking at that, like I would not. I don't know. I mean, and not to put like my own kind of
Yeah,
personal thing on it, but like I would not come to that conclusion by looking at those two things. Like these.
Yeah.
I mean, this is just someone chose two different ways of phrasing the same thing.
Yeah, there was another study about a clinician. So they were a treatment provider that, or no, they were a medical doctor seeing a patient, and one chart said substance abuse, and the other chart said a substance use disorder. And the study showed that they were treated better according to the patient when they were listed as a person with a substance use disorder.
But I would think if you have a disorder like that, that implies that this has been going on for a while.
Yeah.
Whereas if you are just doing it once a year or, for 6 months as a teenager, like, I still think abuse, like I don't have a problem using the word abuse. Like, I think that it is misuse, you're right. But I think misuse and abuse are very similar,
Yeah.
I mean, I know that term can come off sounding pejorative,
Uh-huh.
definitely.
Yeah.
I think it's also about how we're calling people into recovery, right? So if we continue to say you're abusing this substance, then people are like, oh, well, that's not me. I'm not an abuser. Like, I can't tell you how many times I've talked to people around Alaska who are like, I would have entered recovery sooner if I had known that I was misusing substances. But when we use the term abuse, we do identify it. I think there is this mental image that we have in our mind of that person sitting under sitting on a park bench in downtown Anchorage, like day drinking, like a person experiencing homelessness, and that's not me, so I don't have a problem,
Mm-hmm.
right? When, like, again, like you can be fully employed and functioning and like still have a problem with alcohol. So I think regardless of our personal takes on this word, and honestly, providers are the worst when it comes to this word, because when you look at DSM-5, it still, I think, says substance abuse. So it's not a word that like we've gotten over, but I think what from Recover's standpoint, what we'd be inviting people into doing is changing not only the language that we use, but how we view people that do have problems with substances, and like how we can have more honest and open conversations with ourselves and each other so that we can be a healthier community. And if changing my language from the word abuse to misuse helps us get there, simple
So
change.
I think, so this is interesting. I understand this was done to kind of poll people's reactions, but I cannot envision a scenario where we would use substance abuser in an article. I think that it would come out as struggled with addiction or, whatever, pick something. But that's a kind of unusual phrase that I don't know that would. I mean, do you guys have examples of it being used in media like that, or are you just using this to illustrate a point?
Illustrating the word substance abuse versus, so this is talking about how people were referred to, but the whole idea of substance abuse has been around for a long time.
Yeah.
So we'll look at that also, like, wait a minute. So we have, let me just,
And I
there.
mean, one more thing about the word misuse, I think there's also some stigma. I know people who don't use abuse or misuse, they use excessive alcohol use or excessive use of substances. So it's the excessive use that's the issue, not just, it's a different framing of the same, maybe action, but a different
But
feeling.
if you've been prescribed like opioids for a medical issue, you're in pain, and then you get addicted to them, and you don't really need them anymore because your injury has healed or whatever, and then you're still using them, you don't think that that's abusing the
I
medication?
think it's excessive use. I think it's two different ways of maybe talking about the same thing. I feel like abuse is a word that, according to research, is shown to be stigmatizing, and it's outdated. And so I can update my language, because language is always changing, right? It's just words that we use and we ascribe meaning to. So I think when I hear the word abuse, what I hear in that is choice, and what I hear in that is bad. and pejorative.
Right.
And when I hear excessive use, maybe it's like, we know how addictive opioids are. So maybe it's less about the person making a choice and like a chronic brain illness.
Don't you kind of see the example you gave of like the person who didn't enter recovery because they're like, well, I'm not like the guy on the park bench. That guy's abusing alcohol. But if to me, that's like they don't see themselves lumped in the same category. But then if we just change the term that we lump everybody in to that same category, if we say, okay, you are suffering from substance misuse or you are an alcohol misuser, but so is the guy on the park bench, doesn't it end up the same way? Aren't they still then saying, no, but I'm not like that guy? I mean, would it be better to have more categories instead of just changing the term? Because it's just going to it's going to pick up that stigma that the last term picked up.
Maybe. I think what this person was trying to convey was I needed to enter into recovery, and I didn't for years because I didn't identify myself as a problem drinker. But I was. But if problem drinkers are that guy over there and not me, then I don't ever have to acknowledge that. So I hear what you're saying, like there is a spectrum for sure. There's mild, moderate, severe risk and use. But I do think when we're talking about, helping people change their thinking about, because could we agree that alcohol use and excessive alcohol use is a significant problem in Alaska?
Certainly. Yeah,
Sure.
yeah.
So in order to call people into having that hard conversation and saying, maybe my use of alcohol is problematic, we need to break down stigma so that we can actually have those open and honest and transparent conversations instead of it being a secret.
Yeah, no, I get that. I guess
So
I'm
what
fine
we're
with that.
what we're saying is like changing this language in that way and invites people into that conversation is what I.
Yeah, but I think it's also in some ways asking journalists to become advocates, and that's not our role. So I think with some of these terms, it's a term of art, and I think that overall, I get the point that the term substance abuser is pejorative, and it might be better to say somebody who is misusing drugs or excessively drinking or whatever. But I think it's a bit of a reach to really be asking journalists to not use certain words because grammatically they're correct, and I think that they are subject to interpretation, and people in the recovery community are obviously interpreting them in a certain way, and you have some research that's backing that up, but I think there's some gray area here.
Yeah.
I don't think it's black and white.
I just wonder if, and I hear what you're saying. It's interesting that you say, I'm not a journalist, obviously. But it's interesting that, from your perspective, journalists aren't advocates, because I would say journalists are advocates. Well, that's what,
We're
but
trained not
journalists,
to be advocates.
journalists definitely have a way of telling a story that impacts the conversation one way or the other, in my opinion, somebody who reads news all the time and engages with media. But I also think it's about implicit bias. So, I think that the word substance abuse has some implicit bias attached to it, and can we remove that bias by changing our language?
I think maybe part of it is any time, because these conversations happen all the time, generally by email. But it's not just like your industry doing this, right? It comes from all sides. Yesterday, the marijuana industry told me, don't use the word pot. We want you to use the word cannabis.
Mm.
And so I, as a journalist, always have my guard up when someone says, no, this is the term I want to use, because it does come from all sides.
Mm-hmm.
And so then you kind of have, okay, so where do I draw the line? Who do I give into and who do I, argue against, sort of thing. And
I just don't understand if we know a term is more helpful, why we can't use
Well,
Well, we're
I
not
don't
necessarily
necessarily know if
the
that's been
industry. I mean, we're
shown.
reporters. We report news.
Yeah, I think if we look at what we're asking,
I
the,
would
pu-
like
the
more data on that. I mean, I
We-
just saw one slide that said.
yeah,
that,
we
and then
have a lot of data, and just moving to the fact that what we're asking for is saying a person with a substance use disorder, or a person with addiction, or a person in recovery, versus a person with a substance abuse issue. So that's all it is. There's a lot of alternatives.
I do think it's fair. I was gonna say, I mean, I agree with Paula. I think, you know, as journalists, we are constantly inventorying, are we being fair? Is our language loaded? Are there terms that we need to change? And it shifts all the time, you know, AP comes out with updates all the time. And, so, you know, the goal would be to represent as accurately as possible what's taking place, and if there is language that is stigmatizing and dehumanizing individuals, we want to know that. We learn that from lots of different industries, but you know, like I mean, I think that prior slide, you know, a substance abuser, that would just be a sort of unusual. I don't know how the other
Sure.
people here feel. I think that would be unusual. I would not probably use that
Right.
in an article, but I would say experienced homelessness, or struggled with addiction, or experienced, you know, alcohol addiction.
Right. So the AP style book
Yeah, I was just
made
gonna
the
say-
changes and basically just said, they said avoid words like abuse, problem, addict, and abuser. And it went on to explain why in the AP style guide. So
But
they
does-
found enough research to support making that recommendation.
But their change still is not the change that you are asking for. I mean, they say choose phrasing like he was addicted.
Yeah.
Is that?
Yeah.
That to me, I thought
That's
Like-
fine.
people with a heroin addiction, that's okay. I thought you wanted like heroin
No.
misuse disorder.
Well, if it's
No,
if
I'm not trying to-
it is opioid use disorder.
Yeah.
That's the medical term for someone who's addicted to heroin or prescription opioids.
But we're gonna say heroin, you know, we're gonna
Yeah.
identify
Yeah.
the substance
Yeah.
that's involved if we
Yeah.
know it.
Yeah, we're just saying change abuse to addiction or a substance use disorder. And what it does is it puts the person first. It stops labeling them, and just the word abuse, again, it comes with a negative connotation, and it's harmful to people who cannot relate to that, so they don't get the help that they need. But we're just asking journalists to follow what the AP style book says, because they've done the same research.
I wonder if it would be a really good idea to approach a training like this from that perspective. Like, what did the AP style book authors go through in order to figure out that they were going to make these changes?
It's a good point.
That might help journalists understand
Sure.
why some of these changes might be made.
Absolutely. I think that, and there's, I tried to get into the style book online, and you have to have a special access to it. So I couldn't do it, but I know that they used all the same information that we've seen coming, and there was some advocacy behind it, because we often encourage organizations and communities to contact the reporter that wrote the story, to share this information with them, because you'll see headline news that say addicts giving back to their community. I mean, I would prefer that we would all prefer that it said people in recovery from addiction are giving back in their community.
The only thing is, like, we're always trying to minimize the
Yeah.
amount of words we use.
Yeah, I understand that.
So we want to be as concise as possible.
Right.
So that's
So,
also another aspect
yeah.
of this.
And they say if you put diabetics giving back to their community, or diabetics getting better, I mean, that they feel like they're labeled as well. I mean, there's like all kinds of, or people with autism. We say people first versus autistics getting better. Do we? No. We don't label or put a headline news that calls someone out for their illness.
Yeah, I definitely think I mean, labeling somebody as an abuser definitely, is pejorative, but the thing about the fine line between misuse and abuse, like I'm gonna have to research that more because I'm just not buying into
Okay.
that right. You know, like,
Okay.
I feel like I would like to know how the AP decided
All right.
not to use that verb.
Yeah, we can certainly follow up on that. There's so these are other ideas, just changing again substance abuse to misuse or use. Former addict, saying a person in recovery. Someone who once had a problem with alcohol or drugs or once had an addiction is fine, but it's the term addict that is labeling.
What if somebody self-identifies as a former addict? I've had
They
people
often do,
yeah.
and they haven't understood. They don't really understand. If it was me, I'd say a person, who John Doe, who previously had an addiction. That's the same thing as saying a former addict, right?
And I mean, the other thing, we always strive to humanize, right? We don't want to dehumanize with our language.
Right.
So that's another thing that journalists are already cognizant when we go in to write about these stories. So.
Yeah.
That's helpful information. I think another sort of piece I'm calling in from some of my partners in prevention is around, individuals, primarily women who have, died violent deaths, and sort of somewhere in that article, it's their previous alcohol or substance use or misuse is somehow mentioned, as though that legitimizes their violent death, and that is probably not what's the intention of the person writing that article, but that can be dehumanizing.
It can be, but the reality is that oftentimes that addiction or that disease or that illness played a role in the level of vulnerability of that individual and placing them in harm's way. And so it does become relevant to their victimization. And so it's not like this person died, let's draw out the laundry list of all the, negative things about them, but it's really, how did this individual come to this fate? And I think that's important for society to understand. So when those kinds of things are brought up, it's not meant to discredit the victim in any way, or certainly to put those things ahead as being more important. That this was a victim of violent crime. But I think understanding how that happens is important.
I also think there are certain structural, systemic factors that play into who is more vulnerable, that has to do, and so when we individualize circumstances in that way, it kind of gives these larger systemic changes that need to occur at past, but also, specifically thinking about the sort of like a lot of the recent women in Anchorage, predominantly Alaska Native women in Anchorage, who have been victims of violent crime in the past few months. Like, that's in every single article, it seems like. And so that's really hard for the Native women in my life to have to read about, because then it kind of generalizes Native women as vulnerable, or Native women as having
So I think that's
issues.
Yeah, so I think that gets into the advocacy piece again, which journalists aren't. We're not advocating. We're, women who are experiencing homelessness, women who are experiencing addiction, are more vulnerable. And I think if you're talking about Brian Smith and his victims, he was targeting those vulnerable women. So.
I do think though that you can there are ways to do that and be thoughtful.
Absolutely.
And we had, with that exact situation, we had this story that people got extremely upset about for that exact reason. And the goal, I wasn't part of the story, but the goal was to point out that woman's vulnerabilities and not to condemn her for past actions, but it was done the wrong way, and it was like a learning experience. A lot of conversations that came out of that. It's like, how do we show what we wanted to show, that someone exploited somebody else's vulnerabilities in committing a violent act without kind of trying to air her dirty laundry, I suppose.
Yeah, it can be tricky. I mean, there's an earnest representation of the deceased and really wanting to do a good character profile on them, which, requires more time and investment and relationship building with friends and family.
Mhm.
And then there's the intersection of how did this individual, come into contact with the person that harmed them, and what are the factors driving that. And that can be tricky, especially when things are happening quickly and fast. But I had a point. I don't know what it is anymore. So.
But I heard some of your words were really perfect. They were right on the way that you talked about a woman experiencing homelessness, a woman all of that is like previously a lot of people would say like a homeless woman.
Yes.
But you're naturally doing it, what we're asking people to do anyway around addiction,
Yes.
changing that language.
That helped remind me, thank you. So I think, the public question becomes, how did this individual become and sustain this level of vulnerability? And then also, what are the conditions that allowed this person to harm another person? And that's kind of the intersection with the public health question, the public safety question, the policy questions that we ask. And sometimes where people get tangled up as we try to tell those stories.
Mm-hmm.
We do it better than others.
Yeah, I wanted to. You started out talking about humanizing and how we try to. We do have the opportunity as journalists. You do to humanize this. And Zach Siegel, who is an amazing journalist, writer, works for a lot of online news, but also was a research assistant at NIDA, the National Institute for Drug Abuse, and a person in recovery, also from opioid use disorder. Has been in this field and as a journalist for a long time, and he basically just said, by calling me an addict, you define being called an addict defines my humanity with one small facet of my identity, essentially erasing the rest of me. So a son, a father, a writer, a person in recovery, a research assistant. It's the same as we talk about people with illnesses. They're a business owner, they're a politician. There are all these things. They're experiencing cancer, so we need to humanize it as it's just one small facet of who they are. And it's not always, when they make big public news because of something that they've done, that's the way, that's what the problem is, that we only identify them as, the addiction or the criminal act that they faced, but really trying to humanize them as this. So-and-so is a mother, has been experiencing addiction since 2010, has raised, those type of things, rather than calling them addicts. And a lot of people do it. Again, in the charts here, it tells that people still in their own personal recovery, like in their 12-step rooms, they'll say, I'm an addict, and that's okay. We're not trying to change that. We're suggesting that people, especially people in recovery, when they're talking with the media, that they know that they can change the language and change the stigma. So that's what we're trying to do, is through storytelling, that teaching people to tell their stories. So I had a reporter at the training that we did last night in Kenai who has been personally impacted by addiction in his family. So he had a special interest in this, and why we're training people to say, I'm a person in long-term recovery, and for me that means I haven't used alcohol or drugs in 30 years. And if it wasn't for my recovery, I wouldn't be the taxpayer or have a job or have graduated from college. What the public saw in our research in 2001, we did a survey of the general public. If they heard the word recovery, they'd think that they were people still struggling in and out of being well, in and out of recovery. So we had to kind of put an eye at that next piece is, and what that means to me is, so that we can publicly say we're not, this is what recovery looks like. We're everywhere. We're your neighbors, your doctors, your lawyers, your bus drivers, your kids' teachers. So we use that storytelling and that includes like the brain telling the story of what the science is.
Do you think like for that, instead of just saying this person's in recovery and for them that means this, just saying so and so who hasn't drank in 10 years,
Yeah.
is that all right?
Yeah.
Okay.
Absolutely. That's a perfect way to do it. We also suggest that people go through their documents and do a language audit. So pulling out the word addict, replacing with a person with a substance use disorder, searching for the word abuse and replace it with use or misuse. Agencies, state agencies, particularly behavioral health agencies, we're having them go do a word search, and it helps people when they're accessing services see themselves in a different light. They are a person first, and it takes away the stigma. So just briefly, because I know we almost out of time here, I wanted you to know the way that we help people talk with the media, that we have, we train them this way. We have them make it personal. So adding some credibility tells that we can say, this is how I've been impacted by substance use disorders, whether it be personally or a family member or an ally of the person in recovery. Having a consistent message. So I train people to know that if they only had 3 minutes in an elevator with a policymaker, you have to get to the point of your story. And the same thing, I've been interviewed with media for a half an hour many times, and there's only 1 minute or 30 seconds of that ends up in. So be really careful that you're able to redirect. So redirect back to the point of why you're there and what your message is versus I had an interview on the radio I had an author coming in that was a person in recovery, and the reporter said, when I said I'm a woman in recovery, I haven't used alcohol or drugs in X number of years, instead of I was there to talk about this book and this person coming, and he said, well, tell me more about your addiction. What type of drugs did you use? And I'm like, I'm live on the air. So you need to know, we train people to know, well, that's not what I'm here today is to talk about how good recovery is, and that this is what I needed to do to find recovery. And now that I'm in recovery, I'm able to run this organization and pay my, be a parent and all those things. So instead of actually answering the question, we teach them to pivot, to go back to why they were there in the first place. It wasn't necessary, it wasn't part of the story to ask about what type of drugs I'd used. So we focus on the recovery, not the disorder. We tell them these 4 pieces of identify who you are, your relationship to recovery, either yourself, you're a family member, you're an ally to people in recovery, what recovery means to you, and why you're sharing your recovery status. So why you're talking publicly about it.
I will just say from a storytelling point of view, I think details about what they're recovering from is pretty helpful. If you just gloss over that, I feel like readers or listeners are going to be like, I wonder how bad it really was,
Mm-hmm. And what are you hiding?
Yeah, if you pivot like that, you're going to leave a lot of people unsatisfied. I mean, you might be reaching your goal of not getting into the nitty gritty, but I think a good story has to have an arc, right?
Yeah.
And before you get to the good recovery stuff, you have to tell a little bit about what it was like. Like, what are you recovering from?
Mm-hmm.
That's just my personal opinion.
Yeah, I think it's been really helpful in my thinking to equalize, active addiction as a chronic brain illness with like cancer. So if I were talking to somebody who had cancer and is now in recovery, I wouldn't be asking them to tell me about all the times that they vomited because of chemotherapy.
You would ask them what kind of cancer they have.
Yeah.
Okay,
How
so
bad
you
was
might
your
ask them what
pain?
kind of
Like, how did
cancer
it
is it,
affect
alcohol
you?
use disorder or substance use disorder, but you wouldn't necessarily need to know like exactly what drugs they used in order to like know that it was bad. And, you know what I'm saying? Like, I just think it feels invasive.
And that's just an example. I'm not, but the fact that they asked me what type of drugs could have been like, well, how old were you when you started, and what kind of trouble? Tell me about what that led you to, But really, we were there because it's National Recovery Month in September, and we were having a guest speaker come to talk about the hope of recovery. And it was about, so it was more like they were caught off guard that I openly said when I first started the interview live that I was a person in recovery from an alcohol and from alcohol, and, which I said I haven't used alcohol or drugs in over 10 years at that point. But so I would have thought that that would be sufficient.
I think it depends on the story. And in this
Yeah.
situation, I totally think I would agree with you. If you were there just introducing somebody else, you're not really the story, right? But I get that. If it was a profile on someone's life or something, then I think it's, entirely different.
Oh yeah.
So I don't know. I just think
Yeah, if
context.
you're going to write enough about the story, but also about like equal attention to the recovery piece,
Yeah.
that this is what it looks like in their life now. So we have them kind of almost read a script, and actually we do role plays. So there's a reporter, and they sit in front of the room. There's a person being interviewed, and there's a reporter, and they'll ask a question. And so they'll be like, so tell me, who you are and what organization you're with, and they'll role play this language. And then we give them, throw them for a loop, like how do you handle the question that kind of like takes you off of why you wanted to meet with the reporter in the first place, or why they wanted to meet with you. And then they say, I'm here today because my family has been affected. My child has been in substance use treatment, could not get into the treatment program. There was a waiting list for 4 years or whatever, and had to mortgage my house because of it. And that's an important story. That's an advocacy message that we want people to get out. But we also want them to make sure that they understand that the language that they use is really important. So it's not using stigmatizing language. This is for a person in recovery. They would say, I'm a person in sustained recovery, which means I no longer have a problem with substances. I'm able to create a better life for myself and my family. It's given me new hope and stability. I'm speaking out and sharing this with you today because I want others to live a life in recovery. So this is important to know, because we can train people before they go talk with the media about putting a positive light on it. So here again, this is a family member. A family member, which means to me that my daughter has successfully changed her problem with alcohol, a relationship to substances. We've been healthier now. Recovery has given me, my family, new purpose, and I want to make it possible for others to have that same new opportunity. And then for an ally, it's those that work with people in recovery or their friends or whatever. I'm an ally to people in recovery. I'm inspired by people who have overcome adversity involving substance use. I want others to share that enthusiasm. So we have a lot of people that came to the trainings here I've done over the past week that are allies. They work in the field. They haven't actually been impacted personally, but they are learning how to focus on what's important, what the message is, and what the ask is. We also train people to go to the Capitol and talk to their members of Congress and talk to their local state representatives. And we bring people to Capitol Hill and they set up appointments with their members of Congress while they're in Washington, D.C. from all states. And we do this recovery training because what often happens is that they don't hear the positive stories, and using language that helps to shift the stigma. This is just an example of like the different trainings or different types of ways that we train people to talk about it, to eliminate that stigma. And so all of these resources are super helpful, because this one in particular, it says, the recovery dialects. You'll see this last column is about journalists, but this has a lot of dots. It's kind of the light blue colored. If people are in a mutual aid meeting, like a 12-step meeting, they're still going to say, I'm an alcoholic. I go to 12-step meetings. It's my personal recovery pathway, and I still use that language. But if I'm in public, I change it to, person in recovery. Person with an alcohol use disorder, long-term recovery.
Could you talk about relapse?
Sure. There's information that research says that people find that that's not really a medical condition or medical term, that we were trying to move more towards that it's not a willful part of that. It's hard to explain, but recurrence of use. So they returned to using, or recurrence, such as a recurrence of cancer that came back. That's the thinking behind that. You have more thoughts?
Yeah, I mean, as far as the research, I have no handle on that, but we were using this at Recover until about 4 months ago when Renee Rafferty from Providence was like, oh, it's returned to use now. We were like, cool, all right. And so, we are advocates, so we changed our language immediately. The one that I find that we used yesterday in a meeting was medication-assisted treatment. So that's really interesting. That's something I learned today.
In looking at this, my concern would be that with recurrence of use and accidental drug poisoning, readers wouldn't actually know what you're talking about.
Mm-hmm.
Accidental drug poisoning to me seems like someone thought they were taking one thing and took something else.
Which sometimes happens.
Yeah,
But
I
I
don't
guess,
think that's the case.
and it's been really helpful in this setting. One, thank you all for being here. Two, I gained some clarity around roles of journalists today that I didn't have before. Would you say that your role, while not being an advocate, is education and public awareness? Is that something that you're like, yeah, I would do that? So I think maybe in that role, using some of these terms will require some public education and awareness.
This one though, accidental drug, that's really problematic.
I think that would be very
it's over the-
confusing in an article. I don't think people would understand what you're saying.
I mean, that implies like they accidentally drank like rat poison or something.
That's how I read that.
Yeah.
For sure. I don't think I would understand what that meant if I read that in the news story.
I've never seen that term, but
And the other thing to, when you're thinking about changing language, at least from a journalistic perspective, you always want to use less words than more. So like to go from relapse from 1 word to 3 words.
Yeah.
Mm-hmm.
It's
Right.
really not great.
Right.
So
And
if recurrence, maybe just say recurrence.
Sure.
some of this too is in the AP. I mean, basically what they're doing is they're taking active language and making it passive, and they are guiding you to do that. But we are conditioned over years to do the opposite of
Active
that.
voice.
And that's what a lot of this language is it's just turning it into passive language.
I can't speak for the organization, but I think it's a learning curve, it's a learning process, and like I said, providers are some of the worst offenders when it comes to this language. So you'll have doctors and behavioral health clinicians like still using the phrase substance abuse. It just happens because it's part of our language, and so shifting language, it takes time, but it is collaborative. So if there's like at any point, and I know journalism is fast, like you had mentioned, like sometimes you would want to be more intentional, but you just don't have time. But if there's ever a moment to be more intentional and you wanted to collaborate with Recover, we'd be happy to think about what that might look like, or
Another thing that stands out to me on this sheet, person who uses substances, like that sounds kind of happy and uplifting. It's like, oh, like nothing wrong with that. Like that.
Well,
Maybe just a user, like a
Yeah.
user, as opposed to what?
Oh,
there's nothing wrong with there's a drug users union. There's rights and advocates for drug users. There's people that say we have a right to use drugs. I mean, there's a whole movement out there for that. So I'm just saying that the person who uses drugs would be appropriate. That would be much better than a substance abuser. Person who used substances, person who used drugs, person who drinks alcohol. The point is really about the person first.
I use Tylenol.
Yeah.
I'm not abusing it.
Right.
It's a different meaning altogether.
well, within the context of the story, I don't think confusing that with Tylenol. Like, I feel like it would come through, right? Like we were talking about, like this earlier example of the individual, the vulnerable individual who's a victim of violent crime. Like, I think we know that they're vulnerable not because they're misusing over-the-counter medication, because they're misusing substances. For me, it's not illogical, but
Well, if there's any more information that you want, or I could follow up with, I will certainly look into where the AP got all that research, because I did try to find it, and I know people like Zach Siegel worked with the AP on these things. There's journalists that helped to consult with the AP on how that happened. They didn't just come up with it. They got a lot of feedback from headline stories and local news, from people who were saying, that they didn't, especially the person that was referred to may have felt or received some harsh feedback, so being aware that being labeled in a certain way dehumanizes people. So hopefully we can help in any other way, to shift the language.
Do you have our emails to send the slides to?
Yeah, that would be great.
Yeah, Thompson, we can send them all to you.
Okay, great, thank you. All right.
And is this National Recovery Month? Is that why
September is. No,
like, why are you up here now?
I'm here because Recovery Alaska, we're talking about recovery ready communities, so helping communities across Alaska make recovery more available. So there are things like recovery housing, recovery community centers, recovery coaches, peer recovery coaches. It's a whole new workforce, but they're individuals that have their own personal lived experience of recovery that are being employed or deployed out there to like emergency departments after people overdose. The peer workforce would be a really good story.
Super interesting.
Yeah.
the state of Alaska, through the Division of Behavioral Health, is moving forward with peer certification. So peer certification will be a process that people in long-term recovery can go through, get certified, and it's payable by Medicaid.
It's like
Great.
sexual assault advocates go to sexual assault victims, this would be peer advocates. go
Exactly,
to-
and peer support has been used in like the medical field for cancer patients. Like they will actually have peers, people who have experienced it, and they're paid for it, And in the education system for parents with children with disabilities, they have parent advocates. So peer support is an evidence-based practice. It's been around for a long time. And in 2007, the Center for Medicaid and Medicare Services wrote a guidance document to the state Medicaid offices saying, this is an evidence-based practice, you should pay for it. So we've been developing, and this is where like the council, we operate the Council on Accreditation of Peer Recovery Support Services, and we do training around it, and we collect data on it through our RDP. But as a national organization, we work with a lot of organizations that are employing peer coaches, and they may be working at the drug courts, at the child welfare agencies with parents who have lost their children to the child welfare system. So they pair them up with a recovery coach, somebody who's been there. And the similar experience, we call it people with lived experience. So they're comparing, they're there because they've also lost their children and they have found a way to get in recovery and get their kids back. Or they've been through the drug court. And so they're hired onto that staff or that team to have a specific role. They're not clinical, they don't do treatment.
Social emotional support.
Yeah, finding them resources, helping them find housing.
So did you say the Division of Behavioral Health is moving ahead with a program to certify these peer recovery counselors?
Yeah, Jim McLaughlin and Susan Sante with the state, which I think you'll meet. I know you'll meet Jim this afternoon.
Oh, good.
Susan.
Jim McLaughlin, who's the other person?
Susan Musante, Musante. And I know that they've got folks from around the state helping to develop that curriculum or Alaskanize an already existing one. And I want to say they're going to roll that out sometime this spring, but I don't actually know.
But there already are a lot of peer specialists employed. I've seen them in every community that I've worked in already. And there are some that are specialized in working with youth, some that, work actually in treatment programs, but they do a lot of things that we prefer not to call them counselors. They're peer support specialists or recovery coaches, only because it confuses with those who go to get master's degree to become counselors. They're not doing that, and they don't counsel. They provide like guidance, like they help that person do a recovery plan and decide like what they need, for the support that they need.
And Cooking with Tribal Council, I mean, they have a whole peer support
Yeah.
program. So those are people in long-term recovery who have been certified in some capacity to provide that service. I think they also engage in street outreach. They do a lot here locally, and then of course Matsu has a ton of stuff going on.
Does Alaska still rank as one of the highest states in terms of alcoholism rates?
That's a great question. I don't know if I have that in my back pocket. Yes, I mean, we're definitely up there. I don't think we're number one. Maybe Wisconsin.
Can you pass that
One
down?
of the Midwest states is number one. But
Just in case
And then-
follow-up questions, there's my
I'm sure
email.
you're,
Thank
if
you.
you're not familiar, we've gotten a couple calls from Empire and some other media statewide about the McDowell Group's new, I don't know what costs.
Yeah.
Report.
I think I stumbled across that yesterday. I don't know if they had put out a press release about it or
I don't know.
if they're planning to.
I don't know. I could ask if you really want to know. But
No, it's okay. I just was curious.
yeah, I'm not sure, to be honest.
All right. Well, thank you so much.
Okay, thank you for coming.
Where are you based out of?
Washington, D.C. I actually live in Chapel Hill, North Carolina, but my office is in D.C., but I have a total remote staff. I have 11 staff, but we live all over the country.
Uh-huh.
But I end up going to D.C. a lot.